Well, hello. I will appreciate the opportunity to visit with you today about the debate between modified live and killed virus vaccines in breeding cattle. And I just kind of want to go through some data today and kind of show you what's out there available as far as published data to try to help answer this question. That's sometimes a very challenging question to answer and make recommendations for. So. Our goals for today are going to be kind of to go through and just quickly review the efficacy of killed virus vaccines and modified live virus vaccines, and where possible, compare those directly to one another based on what's published in the veterinary literature. We want to go through and review some of the safety concerns about modified live vaccines and look at some of the published studies there as well, and then try to bring all that together and combine that information into a way that we can use all that information to kind of make some decisions and recommendations for veterinarians and cow-calf producers to use based on what's published and currently available in the literature. So when we think about the efficacy of killed virus versus modified live virus vaccines, one of the primary differences is in the ability to induce what we call cell-mediated immunity. So the immune response kind of has two primary arms. One is called humoral immunity, and that's antibody production. That's a very familiar process, and that's how we've measured antibody or immune responses for a long time in terms of measuring changes or increases in antibody production specific for a particular pathogen. So that's one branch of the immune response. The other branch is what we call cell-mediated immunity. And this is immunity that targets pathogens that are actually inside the cell where antibody can't get to them. And so because viruses replicate inside of the cell, this form of immunity is very, very important when trying to fight viral infections. And it is pretty well known that modified live vaccines produce a stronger and better cell-mediated response than killed vaccines do, because these modified live vaccines do replicate. When we inject them into the animal, they do infect cells in the animal, and they replicate in a very similar manner to what a normal wild-type virus would do. And that does a better job of stimulating that cell-mediated immune response compared to a killed vaccine that does not replicate. There are some killed vaccines that do have some label claims for inducing a cell-mediated response, and there is some data to support that, but that response is generally less than that produced by a modified live vaccine, again, because those killed products don't replicate, and they're depending on an adjuvant included in the vaccine to stimulate that immune response. And it does work to some degree with some of the vaccines, but it's not the same or not as effective typically as a modified live product would be. So in this slide, I just want to show you a handful of studies that evaluate the efficacy of killed virus vaccines and their ability to prevent either bovine herpes virus 1 or IBR disease or bovine viral diarrhea virus disease. And again, we're talking just here today about the reproductive effects of these viruses in breeding cattle. Not really focusing on the respiratory effects in calves. That's a whole different topic. But and this is not an exhaustive list of studies that are published. These are just a couple of representative studies looking at a handful of products from different companies. Just kind of want to show you some of the variety that's there. So the study by Zimmerman's group from 2007 was a bovine herpes virus 1 challenge or an IBR challenge. And they compared Virus Shield 6 to a non-vaccinated control. And then they challenged those animals with herpes virus after vaccination. And the vaccine group had about 85, almost 86% protection against abortion compared to the control group that had nearly all the cows aborted. So a pretty high level of protection provided there in that study. The study by Dr. Groom's group was a BVD challenge, and they compared in that study Cattle Master Gold to no vaccine. And it's important to note that Cattle Master Gold is kind of a unique product in that the IBR fraction or the herpes virus fraction of that vaccine is actually a modified live product that only replicates in the nasal passages. So it's called a chemically altered product. So from a safety standpoint, it behaves more like a killed product, but from an immune standpoint, it tends to behave more like a modified live product. But for this particular study, this was a BVD challenge, and the BVD product, the BVD component of Cattle Master is a traditional killed BVD vaccine. So just wanted to point that out about Cattle Master. We'll talk some more about that as we go through the presentation. But for this particular study, we're really only focused on the BVD part because it was a BVD challenge. There was no IBR or herpes virus challenge in this particular study. So they compared Cattle Master Gold to no vaccination, non-vaccinated controls, and the Cattle Master provided a little over 73% protection. So almost three quarters of the cattle were protected from fetal infection with BVD. So not 100% by any means, but certainly better than no vaccination at all. Then the study there on the right is the study from Dr. Paul Walls' group from Auburn, much more recent study. And this study is really nice because it compares products from several companies head-to-head in the same study. And those types of studies are quite rare. They're kind of hard to get funded, and so they're not very common. But when they do get done, they're super nice because they actually give us the most legitimate way to compare the efficacy of one product directly to another when they're done in the same study. When we try to take a product, a study that uses one product and compare that to a different study that uses a different product, there's always a lot of variability there. And so it's not always a very accurate comparison to try to compare the efficacy of those products when they're compared in different studies. But this one's really nice because it actually compares 3 products head-to-head, all against the non-vaccinated control. And again, they measured protection against fetal infection was what they're looking for with a BVD challenge. And so we can see the results there in parentheses. The Cattle Master product provided 57% protection relative to the controls. The Virus Shield product did not do very well in this study, only provided about 7% controls, so very low level of protection. And then the Triangle 10 product covered about 40% protection. So none of the products did an outstanding job in this particular study. That may be related to the efficacy of the challenge model, maybe a very robust challenge. So these numbers, one thing you have to remember is that these numbers, the percentages in these types of studies don't always equate to real life because in real life, the challenge that an animal is going to face is typically going to be much less than what they're given in these types of trials. So these types of trials are set up to really challenge the vaccine and make sure the vaccine is going to work in the most kind of severe cases. And so in real life, these numbers, the protection numbers may be significantly better, but in this particular study with this particular challenge model, we can see the levels of protection there. And we can see that the Cattle Master product and the Triangle 10 product did fare significantly better than the controls relative to fetal infection with BVD. This study is this slide is a group of studies that evaluate modified live vaccines in a variety of challenges, a variety of studies. The first one there on the left by Dr. Gibbons' group was both a BVD challenge and a herpes virus challenge at different time points post-vaccination. This study compared express FP5 to no vaccine to non-vaccinated controls. And what they found is that in terms of fetal infection with BVD, the vaccine provided 100% protection, where none of the fetuses from vaccinated cows experienced BVD infection. In this particular study, the herpes virus challenge was not successful because none of the controls experienced any herpes virus infection either. And so we can't make any conclusions or claims about herpes virus protection because none of the controls had any issues with herpes virus either. So there was an issue there with the challenge, with the herpes virus challenge. But the BVD data out of that study is quite telling in that it provided 100% protection from fetal infection. The next study there on the left from Dr. DeRuse is an abstract that was actually published recently in the AABP proceedings. It was a BVD challenge using titanium 5 compared to non-vaccinated controls and got about 90% protection from fetal infection in that study. So another very high level of protection there. If we move over to the column on the right, Dr. Zimmerman's study, group there has 2 studies. One's a BVD challenge. The first one there at the top is a BVD challenge. And that BVD challenge was actually administered a year after vaccination. So this was a study looking at duration of efficacy using express compared to non-vaccinated controls. And there's a range there because there was a couple of different time points relative to vaccination when the challenge was administered. And the protection was anywhere from 83 to 95% protection against the persistent BVD infection. So that means the persistent infection is where a fetus becomes infected between 40 and 125 days or so with a non-cytopathic BVD virus and then remains infected for its entire life. And so one of the primary goals of vaccinating cows against BVD is to prevent that process. And so many of these studies look at fetal infection, or in this case, it was specifically the persistent infection that they were looking for protection against. The second study there by Dr. Zimmerman's group was a herpes virus challenge, again with express compared to no vaccines. And there was anywhere from 68 to 87% protection from fetal infection with herpes virus. And then the next study listed there at the bottom is a study that was a BVD challenge. This study compared Vista 5 to no vaccination and found about 95.7% protection against persistent infection with BVD. So all of those studies show a very high level of protection to robust challenges with BVD or herpes virus. And so they demonstrate nicely the well-known and well-documented efficacy of our modified live products in preventing fetal infection with herpes virus and bovine viral diarrhea virus. This study by Dr. Rodning's group is a really nice study, again, because again, this is like we talked about a minute ago, this is a single study that compares multiple products together head-to-head in the same study. And in this case, they compared Bovishield, which is modified live, Pyramid 5, which is also modified live, and ViroShield 6, which is the traditional killed vaccine, all compared against non-vaccinated controls and looking for protection against persistent infection with BVD. So again, the challenge here was a BVD challenge. And so we can see the numbers there. The Bovishield and the Pyramid, both the modified live products, provided 100% protection. There was no PI calves in the vaccinated group. In this study, the ViroShield 6 did quite well and provided nearly 90% protection. So it's a little bit hard to make sense of that when we look at the previous study from Dr. Wall's group, where we compared the 3 different killed products, and the ViroShield product did not perform well in that study. And we'd have to go back and look carefully at the exact challenge model to see if there's some differences there maybe in the challenge model or what might explain those differences. But in this particular study, we do see that the modified live products provided better protection, but that the killed product did provide a high level of protection as well. So it can be very challenging to go through and look at all these individual studies and try to use that information to make recommendations for a client or for a producer. Because it's hard to go through and look at all those. You're looking at, a study with one product versus another product, and always got to kind of look and think about, does the population of animals in this study really fit the population that we're trying to make a recommendation for? And that can be really challenging. So it's nice when somebody does the work to summarize those kind of big bodies of literature into one paper. And that's what these 2 studies here are from Dr. Newcomer's group. These are called a meta-analysis. And so what that means is they go through and do a very robust literature review for all of the published studies on a given topic, and then kind of go through and go through a sorting process to make sure that they kind of weed out the studies that were not done in a sound way. And so if a study doesn't have an adequate control group or something like that, those studies are kicked out. And so they take the studies that are done well, that are good science, and then kind of extract the data from those and kind of combine and summarize that data to give us kind of an overall big picture look of what the published literature says about a given topic. So the 2015 paper there was a meta-analysis for BVD vaccination. And so this looked at all papers that compared BVD vaccination to non-vaccinated controls. And they could conclude from all the data that vaccination compared to no vaccination reduced the risk of fetal BVD infection by about 85%. And again, that data includes both modified live and killed vaccine products. When they looked specifically at abortion, vaccination reduced the risk of abortion by about 40%. But again, the persistent BVD infection is the biggest concern with BVD and fetal infection. It occurs much more commonly than abortion and is the most impactful in terms of herd health issues. And so it's nice to see that high level of fetal protection from infection, even though the risk of abortion was not reduced by as much as we might have liked to see. And they did comment in the study that the killed products, or sorry, the modified live products perform significantly better than the killed products. But vaccination with either type of vaccine was significantly better than no vaccination at all. And then the 2017 paper was the same process, but in this case, again, looking at herpes virus or IVR vaccine rather than BVD vaccine. And what they were able to conclude from all the data was that vaccination reduced the risk of abortion by about 60% compared to no vaccination at all. And if they looked at only field trials alone, and again, took those experimental challenge models out and just looked at field trials, then that risk of abortion was only reduced by about 35%. So a little difference there depending on the type of trial done. But still a pretty good level of protection. And again, that's with including both modified live and killed products. And in that particular study with that data set, which was a rather large data set, there was no significant difference in the efficacy of modified live and killed products, but vaccination versus no vaccination provided a significant benefit. So one of the other challenges with modified live products, so when trying to decide are we going to use modified live or killed, one thing to think about is the efficacy, those things that we just reviewed. The other thing to think about is the safety concerns associated with modified live products. So the evidence is pretty clear that when we look at the risk of persistent BVD infection, modified live products are better at preventing that than killed products are. But it's difficult to just make a blanket recommendation that everybody use modified live products because there are some safety concerns associated with those products. And so that's kind of where we're going to move to now, is talking about what are some of those safety concerns with the modified live products. And so, so again, we know that modified live products provide a higher level of protection against the persistent BVD infection. When we look at IVR or herpes virus, pregnancy loss or abortion, vaccination is certainly better than no vaccination, but the differences between the modified lives and killeds is not that significant. But when we look at the BVD component, the modified lives do typically provide a better level of protection. But again, we've got some safety concerns to think about that complicate how we make these recommendations to clients. And so the primary safety concerns for the modified live products are, one, when we give those products pre-breeding, then there's the potential that the herpes virus in particular can infect the ovary and result in decrease in fertility in subsequent breeding for a breeding cycle or an estrus cycle or two. There's also the risk of abortion if we give these products to a pregnant animal. So we know that that risk is there. There's lots of evidence that shows that if we give these live vaccines, which they're abortifacient viruses, they are live, although they are altered. And if we give those to an animal that does not have any established immunity, there's pretty good evidence that there's a high risk of abortion in those cases. And then the other concern, which is probably a lesser concern, but when we think about how these modified live products are labeled, we have to consider this issue as well, is the risk of exposing a pregnant cow when we vaccinate her calf and put them back together. So if we vaccinate that nursing calf and then put them back out with their dams, is there a risk that nursing calf sheds virus and exposes his dam and thereby puts her pregnancy at risk? And so we'll look at all of these different aspects of safety here as we go through these next few slides. So this study by Dr. Perry's group from 2013 was kind of the recent study that kind of kicked off this big debate about the safety of modified live products given prior to breeding. In this study, they used a group of heifers that were completely seronegative, meaning they didn't have any established immunity to IVR or BVD. And they vaccinated all these heifers 8 days prior to breeding. So they used a 5-day co-sync estrus synchronization program, and they gave vaccination at the start of that program. And so it ended up being 8 days prior to artificial insemination. And one virus shield group got the vaccine twice, with their second dose being at 8 days pre-breeding. One group only got virus shield once with the second dose 8 days pre-breeding. And then one group got Bovishield 8 days prior to breeding, all compared to a non-vaccinated control group. Again, there's no viral challenge in this study. This is just looking at safety. And so there's no viral challenge. It's not an efficacy study. And they measured pregnancy percentage both to AI, but then also to overall breeding percentage. And the numbers there in parentheses are actually the pregnancy percentage to artificial insemination. It is important to note that this use of Bovishield in this manner is an extra label use. The labels of the modified live vaccines that have a breeding cow label do say do not give the products any closer than 28 days prior to breeding. And again, that's because they want there to be an estrus cycle between vaccination and breeding to try to minimize those potential negative effects of the herpes virus in the ovary. So giving this product 8 days prior to breeding is certainly an off-label use. And these are seronegative heifers. They were not previously vaccinated or exposed, so they didn't have any established immunity. But when we look at the numbers there, we can certainly see a concerning reduction in AI conception rate for the Bovishield group compared to the other vaccine or non-vaccinated control groups. And so the little superscript letters there mean that if those letters are different, then those numbers are statistically significant in their difference. And so we can see the virus shield groups were not different, and they were not different from the control group either. But the Bovishield group was different compared to the heifers that got virus shield twice, or when Bovishield was compared to the non-vaccinated control. So a pretty significant reduction in AI pregnancy percentage there in this particular study. So that kind of got a lot of people thinking about this issue and kind of generated quite a bit of interest. And so Dr. Wall's group, again, we've made some of their previous work, or some of their work previously. It was actually more recent work, but we looked at it a moment ago. Kind of followed up and did a couple of studies to evaluate the use of modified live vaccines pre-breeding in previously vaccinated animals, which again would be more in line with the label. But they are given in these particular studies, they did give the vaccines closer to breeding than what the label would say. And so in these cases, they used previously vaccinated heifers. So this first study from the Therio Journal was previously vaccinated beef heifers. They had gotten Express at least once, maybe twice before, I don't recall off the top of my head. And then they came back in prior to their first breeding season and they revaccinated them. One group got vaccination 31 days prior to breeding, which would be consistent with the label. And the other group got vaccination 10 days prior to breeding, which is off label, is an extra label use, again, because it's closer to breeding than what the label recommends. And then their control groups were not completely unvaccinated. They did get lepto vaccine, but they were not vaccinated for viral antigen. So there was no modified live virus or even killed virus in the vaccine that was administered to the control groups. These were naturally bred animals, so they did want to have those lepto vaccines in place. And so, but in terms of the virus protection, they functionally served as non-vaccinated controls. And so you can see the numbers there. Those numbers, again, are pregnancy percentage, and there were no differences. So there are some numerical differences, but those numerical differences did not reach a level of statistical significance in this particular study. And so there was no significant negative impact of vaccination pre-breeding with the Express product in this particular study. The second study there by Dr. Wall's group is a study done in previously vaccinated primiparous dairy cows. So these were dairy cows who had had their first calf, and this was their effort to get them bred again with their second pregnancy. And they were vaccinated, now I can't recall. I think they were vaccinated 17 days prior to the start of their synchronization protocol. I don't have that on there for some reason, but I believe it was 17 days prior to the start of estrus synchronization on those cows. And they compared Express, which is a modified live product, to Triangle 10, which is a killed product. And there was no difference in overall pregnancy rate there. And the pregnancy rate is much, much lower. But these are, again, are lactating dairy cows. And so those pregnancy rates are kind of more in line with what you would expect in that circumstance. But the important thing to note is that between the modified live group versus the killed vaccine group, there was no difference at all. And then more recently, Dr. Perry's group out of South Dakota has done some very large field trials looking at this concern about using modified live vaccines pre-breeding. And so the study there on the left from 2016 was a very large study, included about 1,400 cows, if I remember correctly. All those cows had gotten Bovishield previously, at least once, in some cases multiple times. Actually, they had all gotten it multiple times because the cows got it at once prior to this study, but they had gotten it in years prior. And then the heifers that were included in the study got 2 doses pre-breeding, with the second dose being 30 days pre-breeding for the study. So everybody had had Bovishield at least twice. And they compared that Bovishield to VirusShield. So some cows got VirusShield pre-breeding, and then some cows got no vaccine prior to breeding. And so the numbers there in parentheses are AI conception rate, and then the second number is overall breeding season pregnancy rate. And you can see there was about a 6% decrease in AI conception rate when the cows got Bovishield versus VirusShield. And the difference between the non-vaccinated groups were not significant. So, but there was a significant difference between the ones that got Bovishield versus the ones that got VirusShield. And then that difference was less when we looked at overall breeding season pregnancy rate, but there's still about a 3% difference, about a 3% decrease in breeding season pregnancy rate for the Bovishield group compared to the VirusShield group. And so again, important things to note from this are these cows were all previously vaccinated at least twice with Bovishield, and they were vaccinated at 30 days pre-breeding, which is all consistent with the label. In a large study, where there are, and that's what helped find the differences. It's a very large study, but there are some significant differences there. So about a 6% reduction in AI pregnancy rate, about a 3% reduction in overall pregnancy rate. Then the study there on the right is a more recent study, followed a similar setup. And again, it's a large study. I think this one had a little over 1,500 cows, again, out of South Dakota and North Dakota. Dr. Perry's groups in South Dakota, I don't remember where all the ranches were. There were at least 10 different ranches included in this study. And in this particular case, the study did not dictate the exact timing of vaccination pre-breeding, but they did just allow the participating producers to vaccinate at their normal vaccination interval. And so that ranged anywhere from 27 days pre-breeding, which is kind of the very minimum on the label, all the way out to almost 90 days pre-breeding. And again, in this particular study, they compared Bovishield pre-breeding to cattle master pre-breeding. And again, these cows that all had Bovishield at least twice prior to being enrolled in the study. And so we can see there was about an 8% difference in AI pregnancy rate when an 8% decrease in the AI pregnancy rate for the Bovishield group compared to the cattle master group. And the differences for overall breeding season pregnancy rate in this particular study were not significantly different. So there was no difference in overall pregnancy rate, but AI conception was reduced in the group that got Bovishield. And I don't have these numbers on the slide, but when they parsed those animals out based on when they got the vaccination pre-breeding, if they got the vaccination less than 45 days pre-breeding, I believe it was 45 days, somewhere right in that neighborhood, there was a reduction in fertility in the modified live vaccine group. If the vaccine was given 45 days or longer prior to breeding, there was no difference between them. But when they put all these cows together, there was about an 8% reduction in AI conception rate. So one of the conclusions from the study was that maybe that 28-day pre-breeding interval isn't long enough, and maybe we can minimize the negative impacts of pre-breeding modified live vaccines if we give those vaccines out further from breeding. But that becomes a real logistical challenge in many herds in being able to get in those cows when they're all open and 45 days prior to breeding. That's going to be pretty challenging in most herds. So kind of take home message from that study is, again, that there's a reduction there in pregnancy rate. And again, remember the cattle master product is the IBR component is a modified live component, but it's altered in such a way that it only replicates in the nasal passages. It does not replicate and it doesn't become systemic, and so there's no risk of it reaching the fetus, like the more conventional modified live IBR in the Bovishield product. And the BVD component in the Cattle Master is traditional killed. So then the final, or sorry, not the final, but there's the next kind of thought about concerns about safety of modified live products is vaccination of cows during pregnancy. So we say, okay, well, maybe we don't want to do them pre-breeding, but what about giving them a preg check? And like I said before, there's solid evidence that's been around for a long time that if we give modified live vaccines to naive cows or heifers, there is a significant risk there of abortion. But we do have multiple modified live product lines on the market now that have a label for use in pregnant cows. Now, they do say on those labels that the cows must receive their first dose of that vaccine at some point when they're open, and they have to be vaccinated at least every 12 months. And then if they meet those criteria, then we can give the vaccine during pregnancy and be on label for the product. So there's at least 4 product lines out on the market currently that have that type of label. So we're not going to go through all those studies, but I just want to show you a couple of them. So these are some older studies here, and these actually were some of the studies that helped Bovishield get the label for use in pregnant cows. And it was the first of our modified live products to get a pregnant cow label. And these are a couple of the safety studies that were involved in that process. So the first study there on the left was a study where they gave the vaccine pre-breeding, and then they came back during pregnancy and gave it again, somewhere in that 160 to 220 days of gestation. And then the control animals did not get the pre-breeding vaccine, but they did get the vaccine during pregnancy. So they were naive, unvaccinated animals and got the vaccine during pregnancy. So in the vaccinated group, there were no abortions or virus-positive calves, but there we can see in the controls, again, that did not get the vaccine prior to breeding, but they did get challenged with the vaccine during pregnancy. A little over half of them aborted to herpes virus, and about 3/4 of the calves were positive for BVD antibody. So vaccination did have a negative impact on those cows that did not have previous immunity. But when they established previous immunity by prior vaccination, there was no negative impact on those pregnancies. And I can't remember the number of cows in that group, but it was a relatively large study. And then the study there on the right was looking at the safety of giving the Bovishield product at various times during pregnancy. And so they vaccinated cows pre-breeding. In this case, all the cows got pre-breeding vaccine. Then the vaccine groups got Bovishield again, either in the first, second, or third trimester. And the no additional vaccine group got their pre-breeding vaccine, but they did not get vaccine during pregnancy. They were kind of the control group. And so there were no difference in abortion rates between those groups. So giving the vaccine at different points in pregnancy did not have any negative impact on abortion relative to cows that did not get the vaccine during pregnancy. So there are at least 4 products, like I mentioned, that have the similar label, and all of those products are supported by studies that are similar to these. And so there's a pretty big body of evidence out there showing the safety of modified live vaccines during pregnancy when those vaccines are given according to their label. That being said, though, there are some reports of problems still occurring even in the cows that are vaccinated according to label. And so there's a group out of Wyoming, Dr. O'Toole's group, that has reported on this issue a fair amount. And they do have a published paper where they describe 10 episodes of herpes virus abortion. So this is 10 different situations, 10 different circumstances of herpes virus abortion in different herds following the use of modified live vaccine. And all these cows were vaccinated according to label. So they had been vaccinated prior to breeding, they became pregnant, and then were vaccinated again later in pregnancy. And there were some abortion issues. And in all these cases, they were able to isolate herpes virus from the calves. And those herpes viruses were very similar to the herpes virus that was in the vaccine. So it did look like in this particular case is that there was still an issue. There was an issue there with these vaccines given to pregnant cows. There aren't very many of those studies published, but there are some reports out there that do demonstrate that even though there are lots of safety studies that show that these vaccines are safe in pregnant cows, that safety is not 100% guaranteed in some circumstances. The paper there on the right was a review paper from diagnostic labs where they went through almost 10 years of diagnostic lab data, starting right about 2000, which is when these modified live products first started getting the pregnant cow labels. And they looked at the rates of abortions presented to diagnostic labs and what the causes of those abortions were. And over that 10-year period, they did see a slight increase in herpes virus positive abortions. But based on the data that was provided upon the admission forms for those abortion cases, they could not associate the increase with modified live vaccine use based on the data that was available. So they couldn't say that it wasn't vaccine associated, but they couldn't say that it was either. But over the time frame when these products started getting the pregnant cow labels, these 5 diagnostic labs did see a slight increase in herpes virus positive abortion cases. Whether that's just a coincidence or whether there was a causal relationship there, they're not able to determine based on the data available. I have several clients that utilize modified live vaccines in pregnant cows at pregnancy check, and to my knowledge, we've never had an issue. We've never recognized an issue, but there are some concerns out there that are voiced and published in some circumstances. So the products appear to be pretty safe based upon numerous studies, but that safety is not 100%. So one option that's often discussed is to utilize modified live vaccines in heifers prior to breeding, and then switch those animals over to a killed vaccine program after breed or when they're pregnant, to kind of avoid those risks of giving the modified live vaccines to pregnant cows. So this is a study that, again, Dr. Wall's group in Auburn performed and published, where they took 60 unvaccinated, or had 75 animals. They had 60 animals in the vaccine groups plus 15 non-vaccinated controls. All the vaccinated animals got Bovishield twice pre-breeding as heifers. Then half of those animals got Bovishield during their first pregnancy, and half of them got Cattle Master during their first pregnancy. And again, remember, Cattle Master, the IBR is live, but it behaves safety-wise like a killed product because it only replicates in the nasal passage, and the BVD is killed. And then they challenged these animals by pasturing them with 6 known PI animals during their second pregnancy. So they vaccinated them pre-breeding, bred them, vaccinated them with the study vaccines during their first pregnancy, then waited till their second pregnancy and pastured them with PI cattle for 16 days. And then they went back in and revaccinated them again after that PI exposure. And then later in that second pregnancy, they challenged them all with an intravenous herpes virus challenge. So a very long and very complicated study. So this is a diagram directly from the paper showing that they again, vaccinated them pre-breeding, got them pregnant, and then vaccinated them once they were confirmed pregnant. And again, one group got modified live Bovishield, one group got the chemically altered Cattle Master, and one group got only saline. Those animals calved, they were bred the second time, and then they were challenged after being confirmed pregnant. They were challenged with BVD exposure via exposure to PI animals. And then after that exposure, they were revaccinated again. And then they were out here later in gestation, in the second pregnancy, they were challenged with IBR by intravenous injection. And then they were monitored for abortion or calving after that. And so the results showed that in the modified live vaccine group, and so in the Bovishield group, there were 3 abortions out of the 23 pregnancies. And 4 of the 23 pregnancies had a calf that was positive for either BVD or herpes virus. In the Cattle Master group, there was only 1 abortion, and none of the calves were positive for BVD or herpes virus. And so these numbers were not different statistically. So there was no difference between the 2 vaccine groups compared to each other. And then we can see that the non-vaccinated controls, 3/4 of those animals aborted, and all of the fetuses were positive for either BVD or herpes virus or both. And so the challenge was a very robust challenge, but both vaccine groups did quite well. They weren't 100% protected, but they did quite well compared to the non-vaccinated controls. And again, the two vaccines performed equally. So in this case, vaccinating heifers with the modified lives as heifers, and then switching those over to a killed vaccine during their pregnancy performed just as well from after BVD and herpes virus challenge when compared to cows that got Bovishield during pregnancy. So they didn't lose any level of protection by switching those cows over to a killed product during pregnancy. And then the final kind of safety concern is the concern about giving modified live products to nursing calves. And so the body of evidence that looks at modified live versus killed products for respiratory disease protection in calves is pretty clear that the modified live products are superior. The modified live products do provide a superior level of protection for preventing respiratory disease. And so we really like to use modified live products in calves anytime it's possible. But those products do on their labels say that they can be used in nursing calves if the cow is also on the same product. Because the concern there is, again, that we vaccinate the calf becomes viremic, sheds some vaccine virus, exposes the dam, and then therefore puts the dam's pregnancy at risk. So that's a concern. That is a label issue on the product labels. And so I'm only aware of a couple of studies that have investigated shedding of, only aware of a few published studies investigating shedding of vaccine virus post-vaccination in calves. And the first one there from JAVMA used Express in 18 seronegative calves. And they took those seronegative calves and commingled them with seronegative pregnant cows for 100 days. These calves did not belong to those cows. So the level of association between them was going to be a little less than if you put a calf that was nursing on those cows. It's going to have a little closer contact, so maybe a little better opportunity to shed virus and share. But in this case, these 18 vaccinated calves were commingled with seronegative cows. Nearly all of the calves seroconverted to herpes virus, so the vaccine worked. They all responded, all but one responded to the vaccine. They could not, and they collected samples at various time points throughout this study, and there was never any detectable virus from the calves in nasal swabs and other samples. They could not find any vaccine virus. And all of those 103 seronegative cows remained seronegative throughout the study. So those cows were never exposed to enough virus to cause an immune response. So that's pretty good evidence that that particular vaccine does not shed, at least does not shed at a level that's enough to cause in contact animals to develop an immune response to the virus. The study on the right is a more recent study, and this one is not really looking at the idea of vaccine shedding post, or virus shedding post-vaccination from a reproductive standpoint. This was really looking at how does vaccination impact diagnostics when we're trying to do a respiratory disease workup. But we can utilize this data for the purposes of the reproductive discussion as well, because again, what we're concerned about is how often do calves shed vaccine virus post-vaccination. And so this study looked at Enforce compared to Bovishield. So Enforce is a modified live product that's intranasal product, and it has the chemically altered herpes virus, the chemically altered IBR that only replicates in the nose. It has modified live PI3 and modified live BRSV, but does not have any BVD in that product. And then Bovishield is a typical 5-way modified live product. So the calves that got Enforce all were PCR positive for herpes virus on nasal swabs, which would be expected because we put the virus in the nose. We squirted it in there directly, or they did. I wasn't involved, but they squirted the virus in the nose of these calves directly, and so it would be expected to be there. In the group that got Bovishield, there were a fair number of calves that were positive for BVD on nasal swabs. 40% were, 10% were positive on transtracheal wash, and 30% were positive in the blood. And then you can see the numbers there for the herpes virus. 20% were positive for herpes virus on nasal swab, 30% on transtracheal wash, and none in the blood. And so they did find some virus in the Bovishield vaccinated calves, but they did comment that they were using PCR, which is a very, very sensitive diagnostic tool. And the cycle time was very high for the PCR, which means the PCR had to go through multiple replications before it could detect the virus. And so what that means is that the level of virus there was very low. And so there was very little virus there, but PCR was able to find it because PCR is exquisitely sensitive. But it did find it. It just was not very much of it there. And the duration of detection was also short. So it was found, but it wasn't found for very long, and it was found at very, very low levels. So their comment from that paper was that the risk of transmission to in contact animals would be very low. So these are the only two studies that I'm aware of that look directly at that. You may be able to call a tech services vet for other companies, and they might be able to give you some information about a particular product and whether or not it sheds post-vaccination. But as far as what's actually published in the literature, these are the only ones that I know about. Companies will not present that information publicly in a public format because it's not on the label of the products, but they may have some data that they can share with you if you call and talk to them directly. But as far as what's published out there, these are the only ones that I know about. But pretty good evidence that, at least for the Express product and the Bovishield product, the level of shedding post-vaccination is minimal, if at all, and is not enough to really be a concern about infecting those cows and causing a problem with the pregnancies. If I were going to do this, I do have some clients where we utilize killed vaccines in the cows, and we do go ahead and use modified live products in the calves. And I feel very comfortable doing that because I know the vaccine status of that cow herd. If I was going to go into a herd that was non-vaccinated as cows, or that I didn't know the vaccine status on, I'd be uncomfortable doing this if I didn't know the vaccine status of the cows. But for herds where I know the vaccine status of the cows, even if they're on killed vaccines, I'm pretty comfortable using these modified live products in the calves. And again, that's because the benefit of increased respiratory disease protection is significantly higher than the minuscule to no risk of that vaccinated calf exposing his dam and causing a problem. So what are our options? So we've got, there's no real clear-cut answer for every circumstance. So what are our options? So one option would be to take advantage of the improved protection against persistent BVD infection with modified live products, and go ahead and use those products according to the label, and know that in some circumstances there's going to be a low level of risk. Whether we're using them pre-breeding or we're using them during pregnancy, there's going to be a low level of risk in some circumstances. Or alternatively, we can only use killed products and accept that our level of protection is going to be reduced, particularly for the BVD persistent infection. Not much difference for the IBR protection, but there's no safety concerns with those killed products. We don't have to worry about the safety concerns. We can recommend the product line. Again, that's a modified live IBR and a killed BVD. But it's important to note that Cattle Master does have a label for protecting against persistent infection, but in the 2018 study by Dr. Wall's group, it didn't perform very well. So there's some questions there about that level of protection against persistent BVD infection. And again, that in Cattle Master, the BVD is a traditional killed BVD. So that's one option. Then this more recent idea of utilizing modified live vaccines in heifers and then switching to killed vaccines in cows for vaccination during pregnancy. There may be some merit to that. It's only been evaluated and published, as far as I know, with Bovishield and Cattle Master, but it may be a viable option for other vaccine lines as well. And they just haven't been published yet, so we don't really have a lot of data to base that recommendation on, but it seems to be a pretty sound concept. We know that modified live products produce pretty long-lasting immunity, so if we can get a high level of immunity established in heifers and then just kind of maintain that immunity with the killed vaccines, that looks like that might be a promising way to go for vaccinating cows for these viruses. But again, there's only a study or two that's been published looking at that specifically. So we really need some more data to be 100% confident in that recommendation. So for a veterinarian to go out and make recommendations to a producer, it's important to recognize that there's no one-size-fits-all vaccine program. And that's true of any vaccine, not just these virus vaccines, but these virus vaccines are where it really gets kind of challenging to make some recommendations on. There's just so many variables to consider. And so we really need to develop customized vaccine programs for each herd. And it's best to do that based on a risk assessment. So this whole debate about modified live versus killed vaccines is the perfect opportunity to do a risk assessment and base our vaccine decisions based on that risk assessment. So if you can do a risk assessment for a herd for BVD exposure and there's minimal opportunity for BVD exposure and got a closed herd, no neighboring cattle, they don't bring new cattle in, it probably makes sense in those herds to use killed vaccines and take advantage of that increased safety, or maybe use modified live vaccines in the heifers and switch them over to killed as cows. But if you're dealing with a herd where there's a significant BVD exposure risk, so if a cow-calf producer is also a stocker producer and bringing in cell-born calves, or has a stocker producer across the fence where the cow herd's exposed to stocker calves, that's the perfect opportunity to get BVD. And in that case, I would probably lean more toward using the modified live products and accepting there's a little bit of safety risk in some circumstances, but I'm going to take advantage of that higher level of protection. So this is a great opportunity to do a risk assessment and kind of make a vaccine decision based on the perceived risk for the different viruses, rather than just trying to make a blanket recommendation for all producers. So regardless of which decision we end up making, there are trade-offs. So it's very important that we understand and we help our clients and producers understand those risks versus benefits. And the best person to help make that recommendation is a veterinarian who is very familiar with the herd and is able to do that risk assessment in a way that really takes all different components into account, and they can really try to make a good data-based or solid information-based decision or recommendation for the producer. So just kind of in summary, we know that modified live and killed viruses vaccines are more effective than no vaccination. That's well documented. We know that modified lives are typically more efficacious than killed products when we are looking at the BVD persistent infection issue. We do know that killed products are safer than modified live products. So again, there's pros and cons to each one. Based on what's been published, it appears that the herpes virus component of the modified live vaccines is the primary concern. It's the one that causes the primary concern with pre-breeding vaccination. It's also the one that causes the primary concern with abortion post-vaccination in pregnant cows. So what might be ideal would be to have a vaccine that contained a killed herpes virus and a modified live BVD. Because again, the efficacy between killed herpes virus and modified live herpes virus is very small, not much difference there. The real difference in efficacy is with BVD prevention, with the modified lives being better. But the primary safety concerns are with the IBR component of the modified live product. So it'd be nice if we had a product with a killed IBR component and a modified live BVD component, but we don't have that product on the market yet. So that's not available, but maybe somebody will come up with that at some point. So another option might be to use modified live again early in life and then switch those animals over to a killed product. Again, the one that's been evaluated is Cattle Master, and it's a little bit unique. It's a chemically altered IBR and killed BVD, but that option may work as well with other more traditional killed vaccines as well. So we have an opportunity to kind of help clients kind of weigh the risk versus the benefits of various vaccine protocols, and then use those risk assessments to kind of try to match the needs of each operation to develop a customized vaccine program. And that way we can kind of look at, do we want to accept some safety risk for added protection, or do we need to not really worry about that added protection and take advantage of the increased safety of the killed products? And again, I would try to base that on a good risk assessment for each individual client. So that's all I have for the discussion today. I appreciate the opportunity again to visit with you. You can feel free to contact me via email if you have any questions or would like further discussion. I'd be happy to try to answer any questions that I can via email. Thank you very much.